Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello, and welcome to the latest episode of POMA Does. I'm Dr. Valeri Roth, a board-certified otolaryngologist and facial plastic surgeon, and owner of Benesque Wellness Med Spa in Hermitage, Pennsylvania. I'm a PCOM graduate and currently serve as POMA's vice president, the District 9 chair, and the vice chair of the POMA Foundation. After residency at PCOM, I served in the United States Army at DeWitt Army Community Hospital and Walter Reed Medical Center. Experiences here deepened my understanding of service and empathy in medicine. Today, I'm joined by Dr. Alan P. Childs, a licensed clinical psychologist and chairman and clinical director, Dr. Alan P. Childs and Associates in Chicago, Illinois. He's also the host of Mental Health Matters on the Pulse Radio WEKG. With decades of experience in clinical practice, teaching, and media, Dr. Childs brings a unique perspective on emotional well-being in healthcare. Dr. Childs, welcome to POMA Does.
Honored to be here.
Thank you. I'm really looking forward to this discussion. Let's dive right in. When you say empathy, what do you mean? Can you kind of contrast it with sympathy and compassion?
Absolutely. Empathy is an ability to really emotionally understand what someone else is feeling. Very importantly, by kind of imagining yourself in their particular situation, especially clinically, as we describe patients and how we interact with patients in the medical field. Sympathy is more the kind of the feeling, pity, or sorrow for someone, like someone's misfortune, or necessarily maybe just kind of sharing their feelings. And then when we're looking at compassion, it's really kind of the desire to take actions to help alleviate what the patient's suffering after feeling empathy or feeling sympathetic in their situation. Empathy, you just really feel like you're with the patient, really kind of walking in their shoes.
Would you happen to have any specific examples of a scenario where somebody might use compassion versus using empathy?
Great question, Dr. Roth. The compassion component is just really showing the patient how you're truly feeling for them and that you want to take some actions to alleviate. Compassion could be even like hugging your patient or acknowledging them that you're just really sorry about what's happened or what they're experiencing from a health standpoint. That's showing a compassionate point of view, and of course, using eye contact or touch or some visual cue, and really extending yourself as kind of a compassionate approach to a patient. In terms of an empathic approach, will be usually, again, walking in their shoes and truly understanding what they're actually feeling or experiencing.
That brings me to another question. Do you think empathy is innate or is it teachable?
Empathy is, in my opinion, it goes way back in time. Empathy begins even during infancy or childhood. Your social environment actually triggers how you respond to people. The first stage of development, as we know, clinically, is trust versus mistrust. And when we're dealing with a trusting situation, as a child's growing up, they learn to actually show an understanding of what another person is feeling or experiencing or thinking. So cognitively, we know, and medically and clinically, is that children grow up into adolescents, adolescents grow up into teenagers, teenagers grow up into young adults and adulthood. And that's kind of where it begins. The whole factor, doctor, as far as looking at what a person wants to be when they grow up. A person who wants to become a physician or a psychologist or psychiatrist or medical field requires a great deal of empathic approach. So typically someone who's going to be successful and really understand what it's like to care for someone less fortunate or sick and not feeling well is you want to use that empathic approach. And that's where it all kind of begins. So yes, it is innate. It is a skill that is learned over time. We do actually learn over time as far as understanding how we have to kind of focus on a person or the patient and really grow to even develop friendships and outside sources with colleagues and getting together and mingling and understanding what everyone is going through in the medical field.
Are there any specific behaviors or micro skills that signal empathy clearly to patients?
I think typically ability to emotionally understand It's the communication of really paying attention, being aware, connecting, feeling, using visual cues, eye contact, just the approach that you take with a patient. You're nodding and you're acknowledging, and those are cues. And those are micro cues that really allow us to hear what the patient is saying and to truly understand what it is they're going through. I have found in my own experiences that my eye contact, the way I'm looking, the way I'm paying attention, the way I'm kind of redirecting the conversation and acknowledging the particular patient is very important. The visual cues, the understanding, just the acceptance of hearing them and really doing reflective listening, paying attention to what the patient is saying is crucial in really gaining that connection and that trust with the patient, which in my professional and clinical opinion is a very important facet of the whole patient-therapist-doctor connection.
I think that you really hit the nail on the head for me with my interactions with patients in that I listen actively. I'm truly interested. And I think that it is so obvious to patients in how they're able to share back with me what's really going on to help me get to the root of what's happening with them.
Absolutely. I think what's important is the fact that you do practice active listening and are so very skilled at that. Because from my interactions and working with you in different scenarios, that's one of your qualities and your strengths as a physician. And I think it's very important because what you really do from your active listening is really you're minimizing distractions. You're putting aside your phone. You're avoiding computer screens. You're really paying attention. I find I have to do that in my own practice too, as a clinical psychologist, when I'm really listening to someone who's going through a difficult emotional functioning and struggling, I really am paying attention to them and really acknowledging what it is they're saying. Another factor is avoid even interrupting a patient. It's interesting because what we're talking about here is there's some research that states that doctors often interrupt the patient within 18 seconds. That's the current research, which I think is a really interesting statistic. So I think making that eye contact and not interrupting and really paying attention to what the patient is saying to alleviate our own anxiety or questioning as far as what is going on with the patient can really interact or impede the reflective listening. So what I found, even what you're saying, Dr. Roth, is that the typical approach would be like to a patient stating like, if I understand correctly, John, what I'm hearing is that you're really like that, and that's part of the whole interactive listening. Or it sounds like you're feeling stressed about this particular situation. When we acknowledge their emotions, they really feel that we're really there with them. That's part of the empathic approach, even the physical illness or the pain that they're enduring or what they're showing to you or describing what they're feeling as you're looking. I think in general, acknowledging the emotion or just the question regarding what they're feeling or thinking, whether it's medical pain or even psychological or anxiety, what we're doing is we're really saying, I understand this is a really tough situation for you. And I think that really makes them feel that they are really being cared about and being listened to.
I think that it puts current physicians and providers into a difficult position because we have such time constraints. And then you add the computer on top of that. And, that's, again, taking away from that direct patient connection.
Absolutely. And again, validating the feelings and being able to remove yourself from that situation and move from the computer and from the charting and even current trends with artificial intelligence, which is another current trend going on right now. I think there's more of that in terms of kind of impeding and blocking that human interaction as far as, what is actually going on with the patient. And I think things I wish every doctor knew before walking into a patient's room is even like your tone matters more than your title. When you're walking in that room and you're going, knock, knock, hello, I'm Dr. Childs, call me Alan. How are you doing? That's kind of the approach I'll use as a clinical psychologist. I find that patients will really remember that after the visit. There's nothing better than receiving the compliment from the patient. It really helps fulfill my own need to provide the care as a healthcare professional, to acknowledge and say, that was really nice. When the patient says, you made me feel really good after that first visit, I really appreciate that. And that's really great acknowledgement because that kind of gives us an impetus and a motivation to say, this is a patient appreciates being cared about and it feels good. I look at that as a clinical psychologist, the healthcare provider. I think it's real important to we as and healthcare professionals feel good about what we're doing, that self-fulfillment. helps us kind of get through our day much easier.
It sounds like I'm hearing you touch on the fact that physicians themselves need to also be taking care of themselves so that they have the energy and the right focus when they're interacting with their patients. If a physician is coming into their practice burnt out and frustrated, that they're not going to have the energy and the impetus to maintain empathy with their patients.
Absolutely. I think the biggest thing is practicing self-care. Self-care is very important in what we do. Setting boundaries, like prioritizing, making sure that we're taking care of ourselves, like exercise, eating healthy, getting enough rest, making sure we're feeling really good when we're involved in that situation. I think hobbies, again, I'm going to acknowledge that we always tell patients that sleep is crucial. We need to get our proper rest as well. And again, establishing really boundary to really kind of protect our own emotional energy. And I think it's really important, kind of setting limits on our time to avoid us feeling really distressed and feeling distraught ourselves. That's a great statement. I agree.
Do you have any thoughts of how employed physicians who have someone breathing down their neck for time constraints, any little tips or anything you can think of that might help them in that scenario?
I think, again, setting the boundaries and the time, utilizing time for that, what there's like documentation, meetings, clarification meetings, QA meetings, utilization review meetings, any kind of meetings separate from clinical needs to be put aside, kind of putting a boundary factor in a time factor situation. So I think if it's not included in the actual clinical acumen and the time that you're spending with patients plus charting, it's going to be very difficult and very challenging. So again, setting those boundaries and the time constraint, making sure you're able to get that done, maybe even delegating and having someone help, like a PA nowadays will assist the physician a lot with those kinds of situations. And sometimes just that balancing act, the inclusion of someone who's going to be competent and be there for you to help you through those challenges is very important.
You mentioned walking into the room and being aware of your tone. I mean, that costs you no time, minimal effort to make that difference in creating a good empathic environment for the patient. Are there other little tips that you can provide?
I think, again, walking into the room and giving the patient their undivided attention and really doing active listening and really looking in their eyes and paying attention, and the acknowledgement of the nodding and the reassuring that what they're saying is really important is very paramount in terms of reflective listening. So often when you repeat back to a patient, say, my understanding is this is what you're feeling, this is what you're thinking, this is what's going on, and I really want to understand this. Just that reassurance of that connection is so humane and so important in developing that trust that you have with your patient. Because in my professional and clinical opinion, the trust factor is so really important in terms of developing the relationship, because it's an ongoing relationship. And so often then when the patient feels like they've been heard and they feel cared about, that's the most important factor, in my opinion, in continuing the medical and professional relationship that you have at a much personal level with boundaries established with a patient. It's really highlighted and it's really significant because they want to be heard and understood.
I noticed one thing that my staff pointed out. When I walk into a room, I actually greet the patient. I'll say, good morning, Mr. Jones. And I realized a lot of times when I go to a visit, the doctor goes straight to the computer, never says hello. And I'm like, that's such a simple little thing to do. I think that also helps in this scenario.
It really does. And what's also interesting too, it's a whole doctor component. Like a lot of times, even when patients walk into my office, in the first session even, we'll say, hi, Dr. Childs. Nice to meet you. And I'll say, hi, Valeri. Nice to meet you. So what I'll say is, you can call me Alan. A lot of times just acknowledging on a first name basis versus actually using the doctor title in my situation. Sometimes the patient is more at ease when I'm using my name Alan versus Dr. Childs.
Maybe you could make a comment too on your insights about empathy affecting outcomes, like adherence to the care plan, disclosure. That goes right into your issues with trust as well.
Absolutely. I think, in my opinion, medically and psychologically, a treatment plan and a follow-through and communication of progress is really important to a patient. They want to know how they're progressing and what the outcome is as far as the care you're providing. So they want to know if they're showing progress from a clinical standpoint, versus the mental health psychological component. Patients like to be reassured that they're making progress. So a lot of times what I'll do is do a follow-up and even ask the patient, so you had mentioned this particular situation. How's that going now? I usually say, it sounded like that was really important to you. So I wanted to make sure that I followed up, because as you were talking about that, I wanted to make sure that you were feeling better, because we spent a lot of time talking about that. Even from a clinical and medical standpoint, when a physician is going over a treatment plan or there's a situation going on medically, the patient always wants to know, how do you think the medication's working? How do you think I'm progressing? And I think it's really important. From a clinical standpoint, that's not forgotten. The care plan is so very important as far as that communication, building trust, and showing empathy and compassion.
I think it would be interesting if they did some sort of study just with patients with weight loss, diabetes, hypertension, these chronic illnesses, the difference in the approach of the physician to the patient, if the outcomes are actually better.
I think it'll be very good as far as an outcome study to see how that works. And adherence and follow-up, again, is really important, because that really motivates the patient to want to make progress and to do well. And so often what I find is that I'll take one component, one factor of something that a patient has talked about that's pretty important in a particular session, and I'll follow up with that in the next session saying, how did that work for you? Was that comfortable, not comfortable? And how are you feeling about it today? Makes them feel like they're important enough for me as a provider to make sure they're satisfied with their outcome.
I like that.
Thank you.
Do you have any things that you would like to mention about empathy in healthcare that we didn't touch base on?
Absolutely. Empathy makes the biggest difference in clinical encounters by building trust. And I think I am an advocate very strictly, passionately about the whole notion of empathy in medical care. I think, unfortunately, what's happened in this day and age is we are in the rush factor, the time factor, cell phone, social media, computers, iPads, documentation. And I think that has really distracted and has really interfered with our ability to really take that time and really give the patient the time that they need. And I think what really needs to happen is that we have to really pay attention to make sure that whatever question the patient has, that we're answering that and that we're following through. I think that's the key component to empathy. We see the world through the lens of really other people. And one person can make such a difference in what we do for patients. From the time a patient even walks into our waiting room and they meet the person who handles the intake, to the person they talk on the phone to your PA, to your nurse, to your assistant, we all work together. And I know in my office, it's very important that my staff understand that the way we talk to the patient, to empathize and go into the level of even sympathy and then even the level of compassion, that's paramount to give the most quality health care. It's really important that we really direct our intentions to why we do what we do. And it's interesting because in your question, historically, even when I was a child, I wanted to add this to our discussion today, that I was orderly in the hospital, at the age of 17. I washed bottles when I was 14 in the hospital, and that was my life. And I answered call buzzers. I worked with nurses. I worked with your father, Dr. Roth, many years ago. And it brings back such great memories of where I built my skills. And when you ask a original question, where did you learn that? That's really where I learned it. And it goes back to anybody that even sells ice cream, or there's interaction when you're younger. You're learning how to communicate with people. And I'm convinced that my bedside manner and my compassion and the level of empathy that I utilize, that is part of what we do and why I do what I do and why I love what I do. Because it's passion to me to actually be able to have the patient come in and then make sure and be reassured and take responsibility that I'm the one that's going to help them feel better. And it's a tremendous task, but it's like a blank slate. It's like drawing a painting to me, making a picture. And it's just the most amazing feeling, being able to use those skills. And I know you share the same, Dr. Roth.
I think you also touched on something here that I really hadn't thought about, is taking the empathy to your office staff, how you interact with your office staff. Are you empathetic to your staff themselves? Is going to give them a different level of ability to interact with the patients and to set the whole tone in your office that, yes, we're all here with empathy, not just the doctor walking into that room.
Absolutely. And it's interesting you bring that up because with my team, I tell them at least twice a week how much I appreciate them. And when they do something really nice, really tremendous for the patient and make them feel good and the patient acknowledges, thank you for that great care. To me, that is the most meaningful component because we're all in the same boat and we're all working together. So I actually treat my team with a lot of empathy and also compassion because what they're doing is they're expending many hours of time dealing with people in mental health crisis. And I want to make sure that they're also taking care of themselves. So the tying with what you're saying is it's imperative for me to tell them frequently you need to take self-care and take time for yourself. Exercise, eat healthy, make sure you're getting enough rest. Take that mental health day when you need to. Acknowledge when you're feeling tired, acknowledge when you're feeling overwhelmed, because that ties into the whole component to how you really treat your patients and guide them.
I also have to touch base on one other thing that you mentioned about you had gotten the opportunity to work with my dad when you were a young man, and he did influence your empathy. And I also got the chance to work with him. High school, I started in his office. And I think that also gave me the chance to learn a lot from him that was, nothing that you would ever find in a book, but just watching how he interacted with patients. I also learned some of my empathy skills from him as well.
That's absolutely amazing. It's beautiful. It's remarkable. I know because I would observe him in the hospital. And back in those days, nurses wore their nurses cap from all the different schools. And they pulled out the metal charts and we were just writing away. And I'd go in the rooms with them or the nurse would walk in the room with the doctor. And there was such a high level of compassion and time given to the patients. And back those days, a patient needed to stay in the hospital. We weren't having to get pre-certifications and have to, be challenged by the proverbial insurance companies to say, no, the patient can't stay one more day. They know they could stay and they stayed as long as they felt better. But I know just modeling and being able to see what the nurses did and how they treated patients and the different challenges I had, the college students spending my weekends as an orderly taking care of patients. I could vividly remember being in a room with, 4 geriatric men every single weekend. And it was just remarkable because I would take care of them and assist the nurses. And it gave me such an amazing experience just to understand and be compassionate, understand what someone less fortunate and who's being challenged by pain and suffering. It put me in a whole different perspective. And that's why I grew to love what I do.
Do you have any other thoughts that you'd like to share at this time?
I appreciate that. I think we have to be human first. Time is necessary, but everything can be transactional. Medicine can be transactional with business models, but we have to spend time discussing concerns, with the patient and really making them aware of what's going on and to give them what they need. I think that communication level is really important. And again, it goes back to our tone. Our tone matters more than our title. We have to remember that what we do, everything we say and how we portray ourselves when we describe a situation to a patient, they're going to take that and think about that all the time. Patients become very in tune with what we're saying. And it's interesting because I realize and I think about even as a psychologist that everything I say to a patient, I have to assume they remember that forever. And they're going to take that so seriously. So I'm very careful in terms of how I look at them, how I respond to them, how I react to them. I pay attention to nonverbal cues, verbal cues, my listening skills, how I reflect back at them, my memory of what they tell me. And it's all a process. And I have to really think about that everything I'm telling them, they're looking at it as like it's gospel and it's very serious. I can make a mistake too. I might give them some advice, say, I'm not sure about that. I'm going to take that under advisement. And I think they really appreciate that as well. It could be the patient that comes in that I think might have a dementia and I'll refer them out and have a neurologist assess them and I'll have their PCP assess them. So I think in summary, what I'm finding in my profession is that more clinical psychologists are becoming involved in practices. So I'm finding myself really interested in that component of health psychology where I'm getting involved with physician practices and being the psychologist and talking to patients about whatever's going on because it really alleviates a lot of the emotional components to the patient and the physician. So if a patient has anxiety or worry or fear, I love working with MDs and DOs. I just think it's the most wonderful part of my practice. A lot of times I'll be a patient, with a different symptomatology. And again, it goes back to the level where there's an emotional component and I can get into the empathy component and the compassion, but work with the physician directly.
It sounds like there's a lot of room there to partner. Maybe that's something we'll see more of in the future.
It's happening now. Psychologists are partnering more with physicians. And I'm finding that's happening more in the larger medical systems in Chicago.
Well, Dr. Childs, thank you so much for joining me today, and appreciate all of your insights. I've really enjoyed it.
Thank you so much. Thank you, Dr. Roth.
Thank you. Empathy isn't just about what we say. It's how we connect, listen, and show up for our patients every day. If anyone has feedback or ideas for future episodes, please email POMA@POMA.org, and don't forget to subscribe to POMA Does on your favorite podcast platform or POMA's YouTube channel. Thanks for tuning in. We'll see you next time.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.